Medical residents like Jeremy Peterson once learned how to perform surgeries by observing the work of their attending doctors.
Slowly over time, in kind of a stepwise manner, you start feeling more comfortable using the instruments. You do small parts of the procedure.
But 3D printed models are taking hands-on training to a new level.
Well, I think I can go through this bone, and I think I can use this instrument to do it. So let's try it. Practice makes perfect, and if you can do more practice, more hands-on activities without the risk of hurting somebody, I think it's only going to improve.
Using 3D printers to create patient-specific models from CT and MRI scans give doctors and their residents the ability to prepare for surgeries, creating shorter surgery times and ultimately better physicians.
They print out the full nasal bones and all the skull-based bones and then drill those out like you would in real surgery. You can practice that, and you can cut the bone where you think you want to go and see if that in fact is the best way to get to whatever you're going to, either a brain tumor or an aneurysm.
Filament, designed to mimic the texture and density of the organ being modeled, allows residents to practice with real medical equipment. Peterson sees another advantage.
I think eventually the material is so strong that we'll be able to 3D print our implants specific to that patient.
The medical practicality of custom 3D printing doesn't stop at orthopedic surgery. Just downstairs, reconstructive surgeons are using the same machine for more aesthetic purposes.
At the current time, 3D printing allows me and other surgeons to take a look and see three-dimensionally how pieces of bone go together, and then to get an idea of what type of tissue to reconstruct it.
Dr. Andrews, director of cleft and cranial facial surgery at KUMC, recently used a 3D printed model of a patient's gunshot injury to better plan how he'll perform the facial reconstruction.
So in this patient's case, we can make them a nose of some sort preoperatively, such as this. We can 3D print or just make this and sculpt it, and we kind of see what tissue might be suitable for reconstructing a defect of that size.
But Dr. Andrews says the future could go even further.
But the future of 3D printing will probably allow us to actually print the part that we're missing. Currently, we just pick and choose implants off of a shelf, and we look and match what we think would look best for the patient. But if we could 3D print and plan something on a computer that was individualized, I certainly think it would improve the aesthetic outcomes of a lot of the surgeries we do.
Even though researchers have successfully used 3D printers to grow tissue and human organs, Dr. Andrews wants to set the record straight about this medical phenomenon.
There's nothing commercially available.
What's the roadblock there?
Well, a lot of it would be FDA approval for something like that.
But that doesn't mean it's out of the question.
The beginnings of it are probably in the next 5 years, and then probably 10 to 20 years from everyday use.